Hi, my name is Dr. Robert Lakin, and I'm a research associate at York University in Toronto, Canada. On behalf of myself, Renee Gorman, Peter Backx, and the other co-authors, I'll be highlighting our most recent publication in the Journal of Physiology. Our group is focused on unraveling the mechanistic basis of atrial fibrillation, or AF, which is the most frequent sustained supraventricular arrhythmia in humans. And while cardiovascular disease and aging are linked to increased risk of AF, it is now clear that endurance athletes paradoxically have AF risk similar to cardiovascular disease, despite profoundly better ventricular function and cardiovascular health. And the relationship between exercise and AF is complex, with studies demonstrating that intensity, duration, frequency, and total dose of exercise increasing AF risk by as much as tenfold. And indeed, previous studies have suggested that a J-shaped dose-response relationship exists between physical activity and cardiovascular health outcomes, wherein the benefits of low to moderate exercise to reduce AF prevalence yield to increased AF incidence in cohorts performing very high volumes of intense endurance exercise. Unfortunately, establishing an absolute risk of AF with exercise is difficult given the differences in study methodologies, with most conclusions relying on self-reporting to characterize exercise intensities and volumes. Therefore, our current study was designed to assess quantitatively the impact of daily exercise dose on atrial remodeling and AF vulnerability using our mouse swim model. And to achieve this, we quantified the exercise effort or work on mice swimming either 120, 180, or 240 minutes per day, split into 2 sessions, by measuring oxygen consumption rates, and then comparing cardiac and skeletal muscle responses after all mice had achieved the same cumulative work during training. Now, despite physiological autonomic ventricular and skeletal muscle adaptations characteristic of the athlete's heart phenotype, our findings demonstrated a novel interplay between electrical and structural changes in atria that appear to progressively predispose to AF inducibility as daily exercise doses increase above 180 minutes per day, which was remarkably consistent with thresholds linked to AF in humans. And mechanistically, our findings show that the beneficial elevations in vagal tone actually enhanced AF inducibility by reducing atrial refractoriness. Structurally, we found that collagen content and atrial size were increased in exercise mice, with a strong dependence on daily exercise amount. And importantly, tissue fibrosis and hypertrophy were invariably associated with increased atrial inflammation, with macrophage numbers significantly elevated in atria, but not ventricles, of those mice with the greatest daily exercise dose. We believe our study is the first to quantitatively link daily exercise dose and AF risk in mice. And our studies support directly the previous human study suggesting that cardiovascular health outcomes and AF vulnerability show the J-shaped dependence on physical activity. The common atrial features of our exercise mice and persistent AF patients, including atrial fibrosis and inflammation, raise the possibility that the atria of endurance athletes may also undergo adverse changes, which might explain why endurance athletes, especially veteran athletes, have AF risks rivaling that seen in disease conditions despite the well-established benefits of moderate physical activity. Thank you for taking the time to learn more of our study published in the Journal of Physiology. The full paper was published in volume 602, issue 4.